It works. That's the key. You want to get patients at 100% function. You want them to heal. You want them to grow. You want them to detoxify. You want them to do what they're supposed to be doing. The mechanism is not that important. Whether it works or not is the most important thing. Therefore, as vitalists, just to repeat what I said earlier, let us seek out that which creates interference, blockage, or disturbance, causing lack of coordination. And we can ask the body a world of questions, not just muscle testing, because muscle testing does not come from the patient's body, it comes from the doctor's body. The doctor controls the strength and weakness of the muscle, which might surprise you, but it's really, an AK doctor told me years ago, it's an open secret in AK. It's not the patient, it's we're controlling the patient. We can ask a world of questions, like the location of subluxations and the order of correction. People like combination locks. You may know where the subluxations are, but what order? And after you correct one, how do you know others may not surface that are deeper, that then need correction? You have to be constantly, as I mentioned earlier, X-rays, MRIs, CAT scans are photos. That patient, that moment, in that emotional state, in that posture. Asking the body in a vitalistic way is like a movie, constantly getting back and forth, which is the way it should be. We can ask about dental issues and toxicity. When I talk about cancer, that'll be a biggie. Dehydration, scars, dropped organs, emotional issues, valve issues, nutritional issues. We can ask the body what it needs. These questions are only as good as your body of knowledge. So if you are very good at nutrition, or you have a list, or you know what they need, vitamins, nutrients, minerals, actually foods that they need, you can ask their body, would this be beneficial for the patient? Yes, no. And of course, much, much more. We've discovered a few things. One is that the posture of subluxation is very important. Subluxations are sneaky things. They come and go as we stand, as we sit, lie down, as we walk, as we move, as we think. And this is ideal for athletes. This is a little example of somebody doing KST on somebody playing golf. But there's other positions. If they have dyslexia, you'll look at no subluxations. If they have dyslexia, give them a book to read, they'll subluxate. That's their posture of subluxation. And I guarantee you'll see it, guarantee it. So you have somebody who's dyslexic, you clear them out, then you give them a book to read, and they lock up, they subluxate. What do? You correct the subluxations that appear while they're trying to read. Dyslexia disappears, one visit usually. One visit, even if they've had it for decades.